Bismillahirrahmanirrahim. Welcome back friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to talk about reticulocyte count test. Now my name is Muhammad Kamil Khan and you guys watching Kami Microbiologist channel. Let's start the video. Now in this video lecture we are going to talk about the main content related to the lecture. First of all, we have to know about that what is actually reticulocyte and what is actually reticulocyte count test means. Then we are going to see that what are the purposes, uses or the importance, or we can say why the doctor or why this test, why we perform that test. Then we are going to see the principle or the working procedure, or the working principle, means the material, the things which we need in this case, so we have to know about their principle. So we are going to talk about that. After that we are going to talk about the requirements, means the material which we need in this test. Then we are going to see the procedure of the test, means how we can perform that test. After that we are going to see the normal range, as well as we are going to see the calculation, means how we can calculate the reticulus. Once we count that, then how we can find out it, because we better know that when we find out the reticulocyte, so we mostly find out it in the normal means in a percentage, because the normal range of the reticulocyte are always mentioned in the percentage form. That's why its calculation is also important to know about that. Then we are going to see that what are the main causes in which the reticulocyte count are get high and low. Now let's see the introduction. First of all, what is actually reticulocytes and reticulocyte count means? First of all, we have the reticulocytes. Remember guys, reticulocytes are nothing but these are the immature form of the RBC. Immature form of the RBC means which are not mature, which are not functioning, because we better know the normal structure of the RBC. RBC are biconcave in shape, and they do not have nucleus in their cytoplasm. But in this case they have the thread-like material which we call that RNA in the cytoplasm, and these reticulocytes will be secreted from the bone marrow. Then we have the different name of the reticulocyte count. So this reticulocyte count, the doctor also write retic count test, and it will also write, sometimes they will write reticulocyte index. So don't be confused in this case. Okay, so this test is also called retic count or reticulocyte index. Then we have the information about the reticulocyte count test. What is this? Again, this is the hematology test. Now this is actually the series of videos lecture. If you guys remember, we talked different types of the hematology test. If you missed this video lecture, so you can go back to my channel and watch. We talked about the list of the hematology test. We talked about different tests which are used in the CBC. We talked about the CBC test. We talked different CBC parameters in step-by-step video lecture. So these things we already talked about. This is the picture, as you can see. Now these are the mature RBC, as you can see. After the staining, once we make the blood film, and after the staining, what we see the structure like that. These are the reticulocyte, as you can see. Now reticulocytes contain the granules like structure or the thread like structure. These are the thread like structure. So if you found under the microscope, when you make the blood film, and under the microscope if you see these types of the cells, so these are called what? These are called reticulocytes. So you have to count this. Now this is called reticulocyte count test. Then we have the importance or the uses, or why we perform that test. What are the main purposes of that test? We perform that test to just check the function of the bone marrow, because we better know if the bone marrow is properly functioning, so the reticulocyte range will be maintained in the blood. And if it is not functioning properly, so then it will not it will improperly producing, we can say it is producing the RBC not in a normal level. Then the another purposes of that test, it's to diagnose different types of anemia. Okay. Now let's see that what we need while performing that test. In this test we need a clean and dry glass slide. As you can see, a pipette. The pipette will be used for the pipette is actually used to take the solution, or to take the blood and the stain in a microliter. That's why for that purpose we use the pipette. We use a clean and dry test tube. As you can see, we need a brilliant crystal blue stain or methylene blue stain, any one of the stain we need. Okay. Then we need a incubator, or we need water bath. Incubator and water bath will just provide the temperature 37 degree centigrade temperature. Now these are the staining is just used to stain the cell and the test tube is used to mix the solution. And then we have the blood. As you can see, blood in editate tube. So we need blood in editate tube, as you can see. Now again, this is the water bath diagram, as you can see picture. Then we have a microscope. So we need also the microscope. So in this case we need a light microscope, simple light microscope. So these are the things that we need. Now let's see the principle of that test. So in this test, as we talked, that we used methylene blue stain or brilliant crystal blue stain, any one of the stain. What are the purpose of that using that stain? When we use any one of the stains, so it will it will react with the ribosomal RNA. Once it react with the RNA, so then under the microscope it will make actually the precipitation of the granule, and under the microscope you will found a bluish like structure, bluish thread like structure. So it is due to the methylene blue and blue crystal brilliant crystal blue. Then we used methanol, which I forgot to mention in the requirement slides. So we also need methanol. What are the purpose of the methanol? It is used as a fixation. Now this is the slide, as you can see, and this is the smear, as you can see, that we need. Okay. Now then there are the procedure of the test, that how we can perform that test. Let's talk about that. First of all, what we have to do, we have take a clean glass test tube, and then in this clean glass test tube we put 3 drop of the EDTA blood and 3 drop of the stain, means blue stain or brilliant crystal blue stain, and we will mix it, and after that we will incubate it in the incubator or in the water bath for 25 minutes at 37 degrees Celsius. After incubation, what we will do, we will make the blood film from that mixture. Now after that we have to put methanol for the fixation. Once the methanol is put it, then what we will do, we have to examine it under the light microscope, and as we making the blood film, so obviously we make it under the we make it on the clean and dry glass slide. After that we will focus the microscope on 40x, and then we will visualize the cell under 100x. Now under the microscope we found the RBC, and we also found some thread like RBC. So we have to count the thread like inside the RBC there is a thread like structure, so we have to count those types of the RBC using 10 field, and these types of the RBC have a purple bluish color, as you can see in the picture. So we have to count these types of the RBC, these types of the RBC in 10 field. That's how we can perform that test. Now there is another question arise in our mind, that how we can make the smear or blood film. We can also call that blood film, blood smear, or peripheral blood smear as well. Now how we can make it? First of all, we have to take one slide. As you can see, the first slide will, on the first slide what we will do, we put the blood. This blood will be the EDTA blood. Okay. Now once we put 1 drop of the ADTA blood, then what we will do, we have to take another slide. We put the other slide on the first slide, as you can see, and then we will move it in the backward direction, as you can see. So once we move it into the backward direction, so what will happen in the next diagram, as you can see, so once it reaches to the blood drop, so after that, once it's touched to the blood drop, as you can see, so what happened, the blood drop will be spreaded, as you can see. After that, what we will do in the third diagram, as you can see, we have to push the slide, or we have to move the slide in the forward direction. Once we move it into the forward direction, what we get, we see that the blood are spreading in the slide. So this second slide reached at the end, so what we get, the blood smear. So this is called the blood smear. This is how the blood smear is made. Now this is the real diagram. Let me show. This is actually the real diagram of the blood smear which we used in the reticulocyte count, and this is actually the stain one, okay, because we make this blood film when, as you can see, when we mix the drop of the blood as well as the 3 drop of the blood and 3 drop of the stain, and after 25 minutes then we make this stain from this solution. Now let's see that how we can calculate the reticulocyte or the retic count. So remember guys, the reticulocyte will be count in a percentage. So we mostly find out the reticulocyte in a percentage. So how we will do it? First of all, we have to count the reticulocyte using 10 field. Once we count it, so then we have to multiply it with 100, and then we have to divide it with 1000. So 1000 will be our RBC mostly. So once we multiply and divide each and everything, so we will get the value of the reticulocyte that will be in a percentage. Now this is the normal range of the reticulocytes in the adult, and in the adult means in both male and in female we have 0.5 to 2.5% reticulocyte in the whole blood. Then we have the reticulocyte in case of the newborn baby, 2 to 5%. Now here the question arises in our mind that why in this case the percentage is a little bit increased as in the case of the normal age person or in the adult case. It is due to the immature functioning of the bone marrow, because we better know that in the infant the bone marrow is not properly functioning. In this case the bone marrow is not means the bone marrow is not fully mature, we can say like that. That's why the reticulocyte count is a little bit means increased in case of the adult. So it doesn't mean that it is abnormal, it is actually normal case. Then we have some condition and some causes in which the and some diseases in which the reticulocytes level are get low in the blood. The first is the bone marrow failure. Now why? Because the bone marrow is actually secreting the blood. If the bone marrow is failed, so the blood will be not secrete, in which the reticulocyte count is also decreases. Then we have liver cirrhosis. Remember guys, liver cirrhosis means improper function of the liver, or we can say the damaged form of the liver. When the blood is passing from the liver, so what happen? It will degrade, or it will metabolize a different component, or we can say the blood as well. So whenever the blood are metabolizing, because liver if it is not properly functioning, if it is metabolizing, so obviously their amount get low. Then we have radiotherapy. Radiotherapy, it is actually the treatment which we mostly given to the cancer patient, and in this case we mostly use the radiation, and we use the radiation on the target cell that are abnormally dividing. So radiotherapy is also effect on the reticulocyte. Once it is fall down, or if it is react with the reticulocytes, so obviously in this case reticulocyte are also get low. Then we have aplastic and iron deficiency anemia. Both are actually the type of the RBC, both are actually the anemia type, and in both cases what we have the low level of the RBC. If there is low level of the RBC or hemoglobin, we can also say like that. So in this case the reticulocyte count are also low. Then we have vitamin B12 and folic acid. So remember guys, vitamin B12 and folic acid is actually maintain the RBC level, and it is actually also increasing the RBC level, we can say like that. But due to their deficiency, the RBC level is decreases, due to which the reticulocyte count in the blood is also decreases. So these are the disease in which the reticulocyte count are decreases. Now let's talk that how the reticulocyte get increases in the blood, or what are the main causes and condition in which reticulocyte get increased. Let's talk about that. The first condition is kidney disease. We better know that on the kidney we have a gland which we call that adrenal gland that produce erythropoietin. So when erythropoietin is producing in a large number, so it will affect on the bone marrow. So then the bone marrow will secreting more and more blood cells in which the reticulocyte count are also increasing. Then we have hemolytic disease in the newborn baby, in which the blood are fastly degrading, or we can say in which the red blood cell are lysis in the newborn baby. Okay, so in this case the reticulocytes are also increasing. Why? Because the bone marrow is if there is a decrease, or if there is a lysis of the blood cells, so the bone marrow will be activated and they will produce more and more blood cell in the newborn, and thus in this way the reticulocyte count is increasing in the baby, newborn baby, we can say. Then we have acute and chronic blood loss. In this case, in case of the acute blood loss, there is a we can say the blood loss, but not at a high percentage. And in case of the chronic, so the blood loss will be in a high percent. So in both cases what happened, the reticulocyte count is increasing, because due to this way it will affect on the bone marrow. And when there is a blood loss, so obviously in the body the blood is not maintained, and inside the body the level of the blood is decreases. So that's why the bone marrow is maintaining the level in the blood, the level of the blood in so the bone marrow is actually maintaining the level of the blood in the whole body. So due to this way, if there is bleeding, so what happen, the bone marrow is secreting more and more blood cell, in which the reticulocyte count are also increasing. Then we have hemolytic and sickle cell anemia. Hemolytic anemia means the rupture of the RBC, and sickle cell anemia mean in which the RBC are in a rupture form or in a sickle form, we can say like that. So in both of the cases reticulocyte get increasing. In all these cases, remember guys, in all these cases the bone marrow is affected. If the bone marrow is affected, so what happened, there is high number of the reticulocytes. So that's all about the reticulocytes count. I hope you like this video. If you like this video, so make sure to hit the like button, share this video with your friends, and if you have any kind of question in your mind, you can write your question into comment. Inshallah I will try my best to give you answer as soon as possible. If you understand, so please must subscribe our channel and also press the bell icon to get more and more videos like that. Thank you so much.